We got some good stuff, folks. I'm Rebecca Gordon.
I'm Sylvia Gordon. We're talking about the new law that goes into effect January 1st of 2025 that impacts the millions of people that are Postal Service federal retirees and their family members. The Postal Service.
All right.
Okay, so the new law says they got to get Part B. They got to get Part B. Now, they won't have a late penalty if they're 69, 72, whatever. They're getting a letter in the mail.
I think it went out March 1st.
Yes, so they're getting this letter in the month of March that says, and they all have heard this, they've heard rumors, that they have to sign up for Medicare Part B between April 1st and September 30th.
We got 6 months.
So they got this 6-month window. And then starting January 1st, Medicare's primary.
Which is going to be great for
The post office.
the post office.
So the post office is going to save a little bit of cash.
Going to save about $5 billion.
Yeah, so they're going to save $5 billion by taking it and putting it onto Medicare's rolls.
Into their budget, which their budget right now is $292 billion.
Close. 926. Yeah, the numbers, you just had them messed up. 900. So they have a $900 billion budget.
They're going to tack in.
You're going to add on another $5 billion. So like, who cares?
No,
it doesn't impact Medicare that much. Yeah, Medicare's running dry. Yeah, that's not really good, but it's not really going to hurt Medicare.
Right.
But it saves the post office.
Big time.
Because they've been talking about cutting service. They were going to have to cut
Right.
service because of this 75-year pre-funded retirement debacle that they have. So they came up with this 2 years ago.
So this is really good news because for a lot of agents who didn't have access to these clients because they were on the post office, now...
Disruption.
Whoo!
Not a disruption.
That's awesome. That could bring in a lot of new clients this AEP that we didn't have before.
This AEP. So
that's cool.
First of all, they're going to be calling you. They're going to be like, what do I do?
Letter.
You're the Medicare expert.
Yeah.
What do I do? You got to take Part B.
Enroll.
If you don't, you will eventually have to take it because it's primary, and then you will get the late enrollment penalty.
So do it now.
So do it now.
Perfect content again for your newsletters.
They'll start charging you for it
in
starting
January.
for January. And
Really
then
win-win, I
if
think.
they're healthy and they don't want to stay on their federal employee
They
health,
can just suspend that.
and they could go to
Go to
Medicare
Advantage.
Advantage, just like regular
Perfect.
federal employees. So when we talk about federal employee health benefits, FEHB, such as the people that work at CMS,
TSA.
FEHB,
Post office. All
they're
that.
making it, they're carving the Postal Service out, and they are putting them on a new type of federal employment group health plan called PSHB, Postal Service
Yes.
Health Benefits. And they don't have it worked out yet. But they said it's going to be similar to FEHB. But again, when your clients ask you what's going on, we don't know yet. We don't know what that looks like yet. There's nothing out yet, but it's coming.
But we do know the letters were supposed to go out in March. And they've got 6 months.
And your calls could start because a lot of people, just like your other federal employees, say,
Right.
I don't use it. Why am I paying for my
Right.
Postal Service health benefits if I don't use it? Can't I just suspend it and get Medicare Advantage? Yeah, they could. Then they could always go back to their PSHB during what we call open enrollment, or they call the open season for federal employees.
I think of Elmer Fudd.
Open season.
There. Pew, pew.
So again, like Rebecca said, this is great content for your own outreach to your clients, your own videos, your own emails, your social media posts. Get the information out there because there's millions of people that want this knowledge.
Good telling, folks. See you soon.